Welcome to the Grow Your Business and Grow Your Wealth podcast with Gary Helt. Gary is an expert in helping business owners put together a plan that will provide a better future for their businesses, themselves, and their families. On the podcast, Gary interviews other professionals who share his vision, and together they share secrets and strategies any business owner can use to build a better financial foundation for your business and your life.
Hey, welcome back to the podcast. This week, my guest is Jeremy Vesta, and he is the Chief Operating Officer of Curally. Welcome, Jeremy.
Thanks so much for having me.
Sure. So, Jeremy, tell us about what Curally is and what you guys do.
Yeah, sure. So this is kind of a thing that came out of a business that my family and I owned, and been very successful in another industry. Wanted to give back to our employees, something that every business owner should think about. And out of it, we created this system where, we're going to get highly qualified and knowledgeable medical expertise directly in front of our employees, right? The members of our plan, the people that are spending all the money, the people that are having the time off from work, all of that stuff. And so we embed, a nurse condition manager and a medical director into a population, and we get involved in everything. I mean, people have asked, is this advocacy? Is this, health advice? Is this whatever? It's everything. It's relationships. So we go in, we take the chronically ill, the people that are spending the most in your population, and we manage them to whatever degree they need. So if that person initially needs 5 hours of our time that week, we're going to spend 5 hours with them. But it starts, we build that relationship with the individual. Then after we've established the trust in the relationship, then we start to bring in the medical expertise. Then we start to push them to different behaviors, to different specialists, or confirming that what they have is good, moving on to next steps, working on coordination of care issues, helping them feel comfortable with what's going on, helping them to feel empowered that they can do what they're being asked to do, all of those things. And it sounds really simple, but it's as any business owner, and you probably know, it's behavioral management and behavioral change, and that's really tough. That
Right.
takes a lot of effort to get people to change and improve their behaviors, especially when you're dealing with the margins of your company's population or of society, the people that are kind of spending a lot, unhealthy, probably have collateral mental health issues, those types of things. And the thing you find along the way is that by doing this, you utilize less health care, your spend goes down, and these people's health are dramatically improved. Their health conditions are dramatically improved. They're at work more often. They're on leave less. They're not having to go to the hospital. They're not having that surgery they were slated for, different things like that. They're having a better outcome for the surgery they were going to have. So instead of being in the hospital for a month and doing rehab for 6 months, you're talking about, we've had people, get down to 2 weeks in the hospital, and then they go to a rehab program for 3 months, something like that, dramatically reducing the time, finding solutions, making sure everybody's getting the cutting edge care they want, and basically acting as your advocate and helping you along. We have, diabetics that end up off their metformin. They end up off their blood pressure medications, just significant improvements. And the cool thing is what that does throughout your population is improves employee morale, improves the culture that you already are trying to inculcate within your company. And it spreads like wildfire. It just moves within the entire population.
So when you guys come in to do this, you're not, I'm assuming you guys aren't dealing with just those that are quote unquote sick, or those that are, you talked about having surgery or whatever.
Yeah.
You're dealing with the whole employee database, basically.
Yeah, we're going through the entire claims data, biometric data, if your company does it. I know most companies do that nowadays. They have people get some biometric information. And we go through and we sort for risk, right? So it's either you spent some money and have a significant problem that tells a story and it's something that we feel we can dramatically impact, or, I'm looking at your biomarkers and you're going to spend money and we need to get this under control before we get there. But we're trying to deal with the people that have a problem. Whereas, a lot of wellness programs are trying to deal with the entire population and give discounts and do different things. And, I say a lot of times basic wellness programs are for the well, right?
Right.
We've all worked in a company that had a discount to a gym membership. Well, the people that weren't consuming healthcare were the ones utilizing that gym membership. They were already in shape. They were already fit,
Right.
right? It's the people that needed it that weren't using it. We go out and find those people. And the cool thing about us, it's voluntary, but we're reaching out to them. We're like an internal marketing service. We're reaching those employees and finding ways to convince them to join our program rather than just waiting for them to come to us.
So is your guys, your task or your goal is to help small businesses reduce their health insurance cost?
Yeah,
What is
that's
it you're,
that's the
you're
goal
trying to do?
for fully and for self-insured companies. We're trying to get them to bring us in to manage their risk. They might be 500 employees, 900 employees, not teeny tiny businesses, but or groupings of smaller businesses. We've done that in the past too, getting them to reduce their risk pool, reduce their utilization, and therefore their spend goes down, which is ultimately what they're after. But it's more than that. In order to get something like this going, there's got to be a lot of education.
Sure.
So we do on-site presentations. We got to be face to face with everybody in your population, not just those that are sick. But we find it's a really unique product. It's really rewarding for us. We're really impacting people's lives. We've had clients experience regularly a 4.5 to 1 ROI, that type of experience, which I think is really rare in this space, in the kind of third-party healthcare benefit associated type field. When you're talking wellness and those things, those ROIs are very small. Even when you talk about on-site clinics, those ROIs are 1.2 to 1.7, something like that. And that's a very expensive endeavor for a plan, right? So something like us, where we're just bringing in a few medical professionals, but really getting to know people, focusing on the human side. We kind of call ourselves the anti-AI, right? We're actually in front of real people doing the hard work. It makes unbelievable impacts on their lives.
So what are some of the challenges that you guys are facing? When you're trying to talk to a company about trying to get in to talk with them, work with them.
Yeah, a lot of companies, it sounds too good to be true. It sounds like it's impossible, and it is very hard work, because at the end of the day, we're trying to get people to change their behaviors. These are behaviors that people have had for decades, right? That's how they got here. And then they're wondering on the ROI side, well, how much can you really reduce what's happening? And the cool thing is, now that we've really been involved and built out this business and have clients, we have stories to tell. We love to get case studies in front of prospective clients where we're saying, hey, here's a situation that happened. For example, we had a guy that was stage 4 renal failure, kidneys about ready to fail. He was about weeks away from going on dialysis or needing to be on a transplant list. He'd gone on the ketogenic diet because he didn't understand, hey, by the way, that stresses your kidneys when you're in this situation.
Right.
Like we love that diet for a lot of things, but not for this situation.
Right.
Got involved. He hadn't been to a primary care in over a year, did all the things that needed to happen, got him completely out of renal failure. Well, in the area that we were managing him, dialysis center was going to cost him anywhere from $70,000 to upwards of $250,000 a quarter. Just depending on, what situation, how frequently he would need it, and all of those things. So huge cost savings to the plan. But look at the benefit to his life. That guy now doesn't have to take time off work to go to a dialysis center. He doesn't have to sit in a chair and go through that. And he gets to live his life as a normal human being instead of being one of these kind of medically impaired, that's for the rest of your life. This is what you go through, right? So incredible impact from the human perspective, incredible impact from the company perspective. But we tell those stories that gets people excited and kind of helps us get past that barrier. But I would say, yeah, the initial barrier is it sounds like you can't do this,
Right.
until you show them you've done it, right?
Right. I mean, I think that, you know, if anybody sits back and looks at, our healthcare system, everything else,
Yeah.
and the fact that, hey, if you go and you do this preventative care and this maintenance and
Right.
stuff like that, it's going to be a hell of a lot cheaper than you going to the emergency room for something that you easily could have
Absolutely.
taken care of, go into,
Absolutely.
your primary care or whatever. But then also the regular checkups and different things like that are going to help point out some of these things that are going to happen to you, over time. How do you guys work that with individuals? Because again, a lot of us, working, and especially on the men in the world, we tend to not go to the doctors as much, and it's okay, I'm just getting on, I'll be okay. How do you guys work, with those people that just don't want to go? I mean, I got to take time off of work to then go to the doctor, et cetera, et cetera. How do you guys, combat that?
Yeah, so I think the benefit was our initial experience with the company that we ran was a manufacturing business that had some union presence, right? So very challenging environment from that perspective.
Sure.
And what we learned is you really got to cater to those people, right? You have to meet them when they're available. So it's not
Right.
like you can set hours for our nurse condition managers. It's not like they have a 9 to 5 and they know that going in, right? This is, you might have to go to a doctor's visit at 6 p.m. You might have to go meet somebody at their house if you feel comfortable at 7 p.m. that night. You might want to meet them before their shift at 5:30 a.m. or something like that. But you got to find ways to make them feel comfortable and connect. And that's the first step. And then the other thing is, the team that we have, they're really good at forming those relationships. They love people, they care for people. And so when you develop that trust, right, that's why we don't even get involved in providing any of the clinical expertise and advice until we really know this person's bought in. We just want to get to know their story, because these people have socioeconomic issues, they have familial issues, they have collateral mental health issues. There's a lot of things with these types of members of your population that you're dealing with. And so you have to get through that first. You got to really prove to them, I'm not just trying to run a test to charge you and make some money.
Right.
We're not providing care. We're outside of the medical system, which is a beautiful thing. We're acting purely on behalf of you and the company that hired us, period. So we don't have any ulterior motives here. We're not an insurance company. So we're not just trying to cut costs here. We're trying to get a better outcome. And we believe, and we know from experience, if we get a better outcome with you, we're going to make your health better. And by the way, it's going to cost you and the plan less money, which is great. So you earn that trust, and then you take just incremental steps. And that's why it's so intensive. It's a long process.
Right.
This takes months of time investment with these people to move that needle. But once you move the needle and it starts to move, dramatic things happen.
Yeah, I mean, I could definitely see where obviously productivity will be up, and less
Absolutely.
people,
Yeah.
out because of sickness, illness, whatever.
Yeah.
I guess, what are some of the other benefits? I mean, obviously, we're talking, obviously there's the dollars that
The dollars matter,
if people
sure.
are self-insured, that's going to obviously reduce those costs. Again, I can think about things, but what are some of the other things that we're not thinking of that this helps with?
I think there's two really big ones. Number one is company culture.
Mhm.
Um, a lot of companies try to say and give lip service to the fact that I care about my employees and try to show that in various ways. This is a very easy way where you're not having to put in a lot of the legwork. We're doing all of the effort. But, like we've had people with cancer that were on maintenance chemo and thought that was just the end of it. We get an expert involved, find a different solution, go in for a surgical cure, and now that person's in remission. That person's life is saved. That's now back in your population. That affects the culture because they realize, holy cow, this company actually cared enough to invest in a program that it's not just about looking at us as numbers and saying, hey, you got to get your blood sugars under control, otherwise it's going to cost the plan X. It's you saved a life.
Right.
And that person's now here. Our friend, our coworker is now back at work because of what you guys invested in. That's a big story. So I think from a company culture's perspective, it has a huge impact. But from a recruiting perspective, it can have a huge impact because you're talking about something that's I think very unique in terms of what the product is. We've got a wellness so-called product that actually works. It's actually going to have an impact on you. And so the biggest thing is when you're talking about recruiting, retention goes way up, right? These people that you've helped that are wedded to the Curally system, as it were, much less likely to leave your company because they're going to lose that benefit. They're not going to be under management anymore. And they know what they were before Curally. And there's a strong possibility, and that's why we never let people drop out of management. You're going to have those moments where you're going to relapse.
Right.
And if your advocate, if your care team is not there to help you through that, the likelihood is you might be right back where you started and you made a lot of progress. So it cements that whole culture. It seems to reduce your turnover rate. It seems to make you an employer of choice, as we like to say, where you have this product that nobody else has access to in your area. And it's actually moving the needle. It's actually improving health, whereas it's not just a gym discount, right? Or a biometric that, hey, by the way, when you go to your doctor, they're going to run all the same tests too.
Right. Now, thinking about this, a lot of health insurance companies and employers and stuff are going to say, oh, well, we already provide this for people.
Exactly.
Which it sounds like to me this is very different because what the typical employer and insurance company are offering are things where I need to be proactive to take advantage of. And it sounds like you guys are almost, I don't want to say forcing somebody, but you're almost coming in and forcing somebody to start doing that. What are some of the, I mean, I'm thinking of all kinds of
the points of difference,
you
right?
guys are probably running into. I mean, what are some of those? How do you guys overcome those? I mean, because again, we're getting involved in somebody's personal, space, personal life, and things like that. Because I can imagine that you guys are really changing the way that people think and really having to make big changes in their life. I mean, many of us are very sedentary in our jobs and things like that. So obesity is obviously an issue. Poor, diet, the cost of everything going up, food wise and everything else. It tends to be, people aren't eating as well, etc. How do you guys, get around that?
Yeah. Processed foods are cheap, right? People want to go to those products. Yeah. And I like in the initial sales phase, I think it helps that we are independent. We're not part of a health system because, I know your doctor cares about you, but at the end of the day, they got to fill beds and they're not going to shy away from procedures because they've got an ROI they've got to produce.
Right.
They've got to generate profit for that hospital. Reducing utilization is not really a good business plan for a hospital system.
Right.
It's a great business plan for a company sponsored plan. It's a great business plan for Curally. So you take that independence and then you show them the effort we're gonna take, right? So we're putting in, and especially initially, we're putting in a lot more effort than the participant is. They just have to open up their phone, open up their door, meet with us once. We're doing all the work for them. We're going to get their medical records. We're going to do all that thing. We're going to do the research. We're going to have something to give them. I think it's very important early on. We always try with every participant to have some kind of quick value for them, where this isn't something you need to do. This is some insight or something that we're providing that's a value for you early on that maybe you didn't know or didn't have access to, or something like that, that helps get you a little bit engaged. But it comes down to those relationships. They find that we're willing to meet them how and where they are. And most systems won't. If it's a telephonic system, they're going to have a counseling meeting with you maybe once every 2 weeks. Hey, how are you doing? Oh, that's sorry to hear that. Let's try to do better next time. That's not really that constructive. Or it's as simple as sometimes a phone call that says, hey, did you take your lisinopril today? Well,
Right.
okay, that's cool, but that's not the end goal. Because we're there with them and they get a sense very quickly, like, we're not trying to trick you into anything. We legitimately need you to get better. We want you to be healthier. And by the way, here's all the consequences. And here's all the benefits of what's going to happen when we get you there. And we're going to do it together. I mean, sometimes our nurses will take the difficult participant and, hey, come over to our office. We've got a gym in the basement. We're going to work out together, and then we're going to take our blood sugars. I'm going to show you how that impacts your blood sugar. We're not hiring nurses that have been, absolute superstar athletes and physically fit their entire lives. We're hiring nurses that really can relate to the stories that these people have. They've been through the same journeys. They connect with them. And that connection, that relationship is what does the work. And it is hard. And then you meet with them. Sometimes we'll meet with them, go into their house, do a whole pantry makeover, right? We'll go through their pantry and we'll teach them how to read labels. We'll go to the grocery store with them. We'll do that, and show them what they need to do. There aren't a lot of services that you can find that are going to put that kind of legwork and investment in, because honestly, they don't believe it's going to pay dividends at the other side. They think that's too high cost. I can't sacrifice that high dollar asset for that time. Well, I can tell you, if that diabetic hypertensive with a propensity towards a cardiac issue goes unmanaged and you don't spend that time, you're talking about minimum a $300,000 bill. Because
Right.
when they have their event, when they end up in the hospital, when they end up getting admitted, you'll be lucky if it doesn't cost you $300,000 to $500,000 in that spot. Well, that ROI is pretty easy to pencil.
Right.
And
Right.
what we've experienced, what's so cool, is once we start to move the needle, not only do you see the costs come down, the costs are fine, but that long-term impact is so much greater. You're not seeing the large cases show up in as great a number. And that's the key. That means people aren't in the hospital. You're not seeing the chronic conditions. So diabetes, hypertension, renal, cardiac, respiratory. You're not seeing those people, which are totally preventable hospitalizations, ending up in the hospital. And then you start to impact, as you embed in the culture, you start to impact things like orthopedics, because now people are asking your opinion. And it's like, well, you know what, Bob, you've got a BMI of 43. Maybe you shouldn't have that knee replacement yet. Let's work on everything else first. And convincing them that, by the way, your doctor's saying, I don't really know I want to do that, but I might do it if you force me. We're saying, I can get you there. If you work with us, I can get you to a place where either A, you may not need the knee surgery, or B, when you have it, it's going to be very successful. The rehab is going to be much simpler and you're going to be prepared for it.
Yeah.
That's the power of it.
Yeah. And I think a lot of that, when you start talking about the knee surgeries and the different stuff, like
Yeah. Oh,
many,
yeah.
many times the people that need those, not all of them, but many times they're people that aren't prepared for it.
Yes. Yeah.
And then they have it. And then I'm going to say they fail because of, they're not following through with the physical therapy like they're
Right.
supposed to. And many
Yep.
times people think, oh, I'm done with physical therapy, I'm done. It's like, no, you really need to keep
No.
doing a lot of this stuff on your own. And if they're not eating properly, then they're putting on more weight because they can't get around as much as they can. So it's a big circle that
Vicious cycle. And that's what we do. We follow them all. You're hitting the nail on the head. We follow them all the way through, and we keep following them, and we never let them go. We like to go, you think this would be disruptive within the healthcare community, but they actually work really well with us because we go to these physicians and we're like the ultimate extender to them. We say, hey, this guy's going to have a knee surgery. I know you're planning on this kind of rehab, but ideally, what would you really want him to do?
yeah.
Instead of avoiding risk, what would your prescription be if you could get him to do what he really needs to do? Well, let's
Lose
do
50
that.
pounds
Right.
before we have the surgery.
Right.
And yeah.
And the same thing with just the primary care. So you've got this guy on a beta blocker and this and that. Your care plan for this individual is purely avoiding risk. You're saying, I'm not counting on this guy to make any changes in his life.
Right.
And if he doesn't, how do I avoid the catastrophe the best I can? Well, what if you can write that care plan for what do you really want him to do? Instead of preventing the catastrophe, what would you really like to be in that care plan? Do you want to see him reduce his meds, in 6 months? Do you want to see how much weight do you want to see him lose? How much exercise do you want to see him lose? You prescribe it. That's fine.
Right.
And then we'll implement it and make sure they actually do it, and we'll follow them through. And because they trust us, now they trust their doctor more. Whereas a lot of these people, because of the way the system is today, you get 5-10 minutes with your doctor. They don't always trust their doctor. And
Yeah.
that's really sad because that's not really where it should be. The doctor still has your best interest at heart 90% of the time.
Right.
It's just that they don't have, they're working on a throughput model and a cost model just like all of us. They've got to get bodies through, right?
Yeah. I mean, and I could imagine when you guys are working with people, you're working more holistically with them, and the fact of because I see it especially with more the elderly, they're going to 4 different doctors
Yeah.
and 4 different prescriptions and different things like that, and nobody's really paying attention to, hey, this medication over here that you're taking counteracts what this one's going to do, or it exacerbates it, or whatever.
Yeah.
And nobody's doing that. So it's kind of, you guys are doing more of that global
Yeah.
looking at it. So based on in your guys' experience and stuff like that, kind of what's your sweet spot in the number of employees
Yeah.
that somebody needs to have for this to make sense?
We like to have relative close geography, which, that could be 50 to 100 miles. It doesn't have to be super small, but we like to at least have conglomerations of, let's call it 900 minimum lives. So minimum, you're talking about plan members is usually what, 2.2 times that.
Okay.
So, then you get 900 plan members, 900 employees of certain groups together, single employer, whatever. But that much risk, that helps us manage that, which, a lot of these smaller businesses kind of need to be looking at, especially with where these self-insured plans are going. I mean, I know, we've got a small office here, and our health insurance rates went up by about 13% this year, right? You got to look at pooling the risk in your local community. Whether you're that big of a business, you got to find cooperatives and pool that risk. But yeah, I think it takes about 900 members to really find the risk profile that justifies this kind of management. But when you get there, man, I mean, the results are unbelievable. They're
Now,
unbelievable.
when you guys do this, does it include the family members and stuff like that,
Yep.
or is it just the
Yep.
employees?
Nope. Any covered life under the plan. That's the point. And oftentimes it's the family members, and sometimes we'll try to manage the employee even if they don't have as much risk, because we know when we form that relationship we can get to the other. And none of those other healthcare services ever touch the spouse very well.
Yeah.
You know, that's a really difficult thing to get in contact with. You know, letters in the mail go in the garbage, emails get deleted, phone calls go to voicemail. You know, we're all good at ignoring all that stuff, and we have to be, right?
Yeah.
So
And I can imagine that it's, if the employee or the spouse or whatever is having a health issue, whatever it is, that's probably the same thing inside the family and stuff like
yeah,
that. If there's,
yeah,
bad eating habits and stuff like that, it's going to be
it's
across the
everywhere.
board. It's not going to be
It's across the
that one
board.
person typically.
Yeah.
Um, you
Yeah, and I
know,
think what the urgency is for businesses of services like ours is you're tasked with a really difficult challenge because you're providing HR benefits, you're providing healthcare benefits because you need to be competitive.
right,
You got to be competitive. But then once you provide those benefits, you don't know anything about the healthcare system and how to navigate it. And oh,
right,
by the way, it's not really that friendly to you either because it's trying to extract more value, right? So,
right,
so you got to have some kind of expertise. And I'd encourage smaller businesses, if you can't hire a service like this, if you can't find a way to pool, you need to empower yourself. You need to get more familiar with the claims that your people are generating. You need to try to find some clinical expertise in your area. You know, I'm sure there's doctors in the area that would love to come and give a presentation on health, or some nutritionist or something that you can pay a small amount of money to at least start educating your people, and show them what the long-term impacts are. Because if you're not going to focus on that, if you're just going to treat it like a sunk cost, you know, you're going to find yourself with a pretty overwhelming burden at a certain point. And then you're talking about, hey, does the employee pay more of this? Do
right.
I have to cut the benefit altogether? That's going to really hurt my recruiting power. And it doesn't have to be that way. I mean, we had a client this year that didn't have to increase their premiums at all.
Wow.
Pretty
That's
remarkable
pretty,
in
I
this
was gonna say,
environment.
that's pretty impressive because,
Right.
like
Right.
I said, I mean, based on my clients, I've kind of seen, from what I'm being told, I mean, anywhere from 15 to 20%
Yeah.
increases this
Yeah.
year,
It's heavy.
so
It's
it
heavy.
was much larger than it has been in the past. So that's for sure.
Yeah. You can imagine when somebody goes to interview from a job that's not in your company and your premium stayed the same and you look at what their healthcare costs are, all of a sudden that salary difference means a little bit less.
Right, right, definitely. So Jeremy, we've covered a lot of stuff. I think that, what you guys are doing, you may not think it, but I do think it's more cutting edge, for
Sure.
people because there's not many of
Sure.
you out there that are doing this. And I think it is, if we really take a step back and you think through it, if your company's large enough, I mean, it's definitely something that's worthwhile to take a look at. What have I not asked you wish I had?
I think I want to touch back a little bit on what I said. I think pooling risk is a big deal. I think cooperatives for small business, that's something that really needs to happen. It's not something that we've been involved with. We see it a little bit around there, but as these healthcare costs get to be more and more expensive, I think finding groups that can pool their risk and have kind of a health share amongst companies and become self-insured instead of fully insured, finding ways to get to that point, really important. Because I don't think you're going to find that self-insured rates are they're gonna manage the risk, right? And the risk
Right,
keeps going up every year. And then once you're involved in a group like that, then you have a little more control. Then you can see what's going on. Then you can talk about real things. Then you can make improvements like what we're doing. But to just take all of this as a given, it's pretty tough nowadays because I think you're going to find small businesses unable to provide healthcare benefits at a certain point as this gets kind of out of control.
right,
So I'd encourage everybody to get creative, come up with, you're going to be able to sell it. If you're in your local area and this is something you have the expertise to create, I think, you're going to be able to sell this to other people because everybody's struggling like you are.
oh yeah,
Uh,
yeah,
something like that. So I think that's just something that's pretty important. You know, the insurance company's not going to do you any favors when they pool your risk, right? So you kind of got to do your own thing.
Right, right. I mean, insurance companies are in the business of collecting money.
Yeah,
I
absolutely.
mean, that's really what it is.
Absolutely.
So,
Absolutely.
so Jeremy, if if the listeners like what they hear, or they're
Sure.
not quite sure, they want to reach out to you, how can they reach out to you guys?
Yeah, just go right to our website at curally.com. There's a information sign up right there. It'll come right to our team, and we'll get back to you with some information.
Great, great. Jeremy, I appreciate your time today. I think that this is a topic that obviously we're going to be hearing more and more about, because, as healthcare costs keep going up, they're going up faster than just about anything else right now. So I definitely think there's going to be more people looking at this in the future.
They have
So,
to. Absolutely.
appreciate your
Thank you
time.
so much.
Great. All right, this week our guest was Jeremy Vesta, and he is the COO for Curally.com. Thank you, and I'll see you guys next week.
49 faces looked to him in triumph. Over the last 12 months, they had each taken turns and promoted his business for a week at a time, driving over $987,342 in revenue. What if you had a network of 50 centers of influence who promoted your business every week for a year? Grab your copy of the #1 Amazon best-selling book, The Ultimate Guide to Growing Your Business with a Podcast, at 33% off the Amazon price by going to ultimatepodcastbook.com. Again, that website for 33% off the Amazon price is ultimatepodcastbook.com.